So my name is Tomas Aleman. I am an associate professor at the University of Pennsylvania School of Medicine, specifically at the Shea Institute, and I'm part of an institution within an institution, the Center for Advanced Ocular and Retinal Therapeutics, which is a group of researchers at Penn that are dedicated to try to find treatments for choroideremia and other genetic eye diseases. So I'm a retinal degeneration specialist by training. I've been involved in CSM research for over 20 years. More recently, and with the help of the CRF Foundation, I'm co-PI of one of two clinical trials that is exploring gene therapy as a form of treatment at the University of Pennsylvania, together with Harvard University. We are now reaching the 5th year of the trial, and we are hoping to have results published soon, at least preliminary results of our trial. CRF Foundation has been instrumental to this effort. Without the help of patients, this kind of treatment experiment would not have been possible. Basically, we have been following patients now, a large group of patients with CHM for over 10 years, or reaching 10 years right now. And that was basically the premise, to be able to be ready to do an experiment and interpret the results. And for that, I'm forever thankful. Gene therapy has a long history, almost 50 years old now. The history is intrinsically related to Penn. We were the first group of people to kind of bring the experimental work in animals to patients for a different disease, a disease called Leber's congenital amaurosis, and that set the proof of concept to advance the same type of treatment for other genetic diseases. Choroideremia was a target only because we knew the disease very well, or I thought we knew the disease very well. There's a lot to learn from the disease, but we wanted to just translate from one disease to the next, and choroideremia presented a possible target to that transition. It's never an easy transition. It's a transition full of complexities, and a transition that will ask questions of us in need of answer. And again, we are still not ready, I think, to call it final. It's only the initial steps towards a solution. If not for every patient, that would be unreasonable to think, but for a substantial group of patients, or at least for a part of the disease spectrum, may be eligible to this type of genetic manipulation. And it's only the beginning, because we are having now a second era of introduction of new ways of handling genetic diseases with newer treatments that may present similar opportunities for this condition. So what can patients do for research? And patients are doing it just by sticking with us and sticking through all of the complexities of our treatment attempts. Basically, it's critical for the understanding of the disease to have a clear understanding of the natural history, and that's a word that has been used too often, unfortunately. It's often trivialized. We need to know the deep phenotype of this condition and how it behaves, and I don't think we have the answers to everything. We have partial answers to very complex question or set of questions. And for example, we know the natural history of some of the things that we do through imaging the retina, and patients are usually engaged in that aspect of our research. We need more than that. We need to know a little bit more about the functioning of patients, in real world scenarios, which we don't know too well. We don't know how to quantify that too well, which is something that is critical as outcome measures for clinical trials. So how does an intervention that may shift a little bit what we do or what we measure clinically, how does that impact a real life situation in patient? And without patient participation, that research cannot be done. I have been at least 3 or 4 times physically present. Every time I come, I have the same impression. It serves as a stimulus for us to keep moving forward. It's a very different interaction when we interact in the setting of a clinical trial, in the setting of a research, or in the setting of a clinical encounter. It's very different, that interaction, from the interaction that we have the opportunity to have here interacting with families. It brings a totally different feeling. When you're doing this clinically, you often detach yourself or have there is a risk of detaching yourself from the human part of things when you're doing research or when you're seeing patients clinically. So coming to a situation like this, to a meeting like this, reminds you of the humans and the families behind what we do, and it serves as an stimulus for us to keep going forward. I would encourage them to come. There is nothing like, especially in rare diseases. I'd like not to call it rare. I like to call it infrequent diseases. There is nothing like seeing somebody that is sharing with you the same experience, and sharing that. I don't think there is any other. Nothing beats that. If you do it virtually, that's okay. If you do it physically, that's fine. But you have to do that. It will bring you basically, you would share purpose, and the purpose not only of finding a treatment or a cure, which are big worlds, but of coping with a difficult situation for any family to go through. So the meeting has at the root of the meeting is basically creating a sense of community and a sense of common purpose, and that's important. I think extremely important. No, I'm not surprised. I'm actually used to it. The patients actually are so well informed. Patients with CHM, they are so well connected. It is actually common in my clinic that I learn of treatment attempts or even of experiments that are taking place or things that are taking place. I hear sometimes for patients. So we can't pretend that we know it all as clinicians or clinician scientists, but often patients bring about uh, things. They're very well informed and they're very well connected, and the interaction with them often basically brings about questions that sometimes we as scientists are so focused on something that we don't realize of specific questions, and often the patients are the ones who are smart enough and informed enough that they are able to come up with those questions that otherwise would have passed above our heads. So I'm not that surprised. I'm actually used to it, and it's actually one of the things that we like of coming to events like this. You get a feedback that you cannot get from your colleagues at the universities where we work with. It's a different kind of view of things that I cherish so much. I thank the foundation and every specific donor that has provided funding from our studies. It doesn't matter the amount, it doesn't matter the time. It's always welcome. We are going through very rough times, so it's particularly through these times that we have to be thankful and appreciative of the of funding bodies, specifically the CRF. Without their support, it would be impossible to do what we do.